let's just dive right into the source material today because we're looking at a massive distinction in modern medicine. We hear the word diabetes literally all the time, right? But the reality we're going to break down for you is that there are actually two totally distinct conditions sharing that one name. And honestly, they're completely different in what causes them, how you treat them, and what daily life actually looks like. So whether you're managing this yourself, maybe supporting a loved one, or you're just here to get a solid grasp on the medical facts, this deep dive is going to clear up the confusion once and for all. Let's get into it.
To really get this divide, we first have to understand normal biology. Just imagine your body is this incredibly complex machine, and its absolute favorite fuel is blood sugar, which is also known as glucose. But, well, there's a catch. That fuel can't just float into your cells all on its own. Your cells essentially have locked doors, and those doors require a very specific key to unlock them and let that fuel inside. That biological key, it's a hormone called insulin. Without insulin, the fuel is just totally locked out. Simple enough, right? Keep this key and lock analogy in mind as we go, because it's literally the secret to understanding everything we're about to cover.
So at a macro level, here is the absolute simplest way to remember the difference between the two. Type 1 is fundamentally an autoimmune problem. Basically, your immune system gets confused and physically attacks your own body. Type 2, on the flip side, is a metabolic problem. The machinery is still there, but it's wearing out from overuse and resistance. So it's not an attack, it's more like systemic exhaustion. Let's break down exactly what that actually means, and we'll start with Type 1.
Section 1. Type 1. The missing key. The factory has been destroyed.
So what is actually happening in a type 1 body? Well, the immune system makes a massive mistake and attacks the beta cells in the pancreas, literally destroying them. And this is absolutely crucial. These beta cells are the only cells in your entire body that produce insulin. Out of the trillions of cells you have, your immune system specifically zeroes in on and assassinates these few. The factory is just gone. The result? An absolute deficiency. You've got plenty of sugar floating around in your blood, but zero keys to unlock the cells. And this leads to a very high risk of ketoacidosis, which is this dangerous buildup of acids in the blood simply because the cells are starving. Now, we've got to bust a major myth here. So many people think only kids get type 1. No way. Not true. While it does usually develop pretty quickly in lean children or teens, you can absolutely develop type 1 at any age, even your 50s or 60s. Actually, it gets misdiagnosed as type 2 in adults all the time, but overall it is relatively rare, making up just about 5 to 10% of all diabetic cases.
Section 2. Type 2. The broken lock. The locks are gummed up with fat and gunk.
Now over in Type 2, your body is still producing insulin. The factory is open for business, but the cells become resistant to it. It's like the key just doesn't quite fit the lock anymore. Your pancreas notices all this sugar isn't getting into the cells, so what does it do? It tries to compensate by working absolute overtime, pumping out more and more keys to just force those doors open. But eventually it gets tired, and the sugar starts building up in the blood. This whole process typically develops really slowly over years, usually in adults over 40, though honestly it's becoming increasingly common in younger people today. And while you always hear people say you get type 2 from eating too much sugar, the reality is it's actually driven way more by total calorie excess leading to obesity and inactivity. Plus, there is a massive genetic component. I mean, some thin people get type 2, and some obese people never do. But this type is by far the most common, making up about 90 to 95% of all cases.
So the whole distinction basically comes down to this. Type 1 is an absolute deficiency. No keys are made. And prevention? Not possible, because it's a genetic and autoimmune issue. Type 2 is a relative deficiency. The insulin is actually there. Sometimes it's normal, sometimes it's even high, and then eventually it goes low. But the locks just don't work. And unlike type 1, type 2 is actually often preventable with lifestyle changes like diet, exercise, and weight management.
Section 3. Fixing the locks and finding keys. Navigating treatment paths.
Okay, so when a patient is newly diagnosed, their immediate reality looks vastly different depending on the type they have. Just look at the immediate need here. If you have type 1, you need insulin injections or an insulin pump from day one, full stop. It is an absolute lifelong life-saving requirement. Why? Well, because pills won't work. Pills usually rely on stimulating your pancreas, but if the factory is totally destroyed, there's literally nothing left to stimulate. Now, for type 2, the first line of medical defense is usually lifestyle changes to clean out those locks. Losing weight, exercising, along with pills like metformin to help those locks work better. However, over a 10 to 20-year progression, a type 2 patient's pancreas might actually wear out completely, which means they too might eventually need outside insulin. But remember, for type 2, that's a long-term progression, not a day one failure.
Let's put ourselves in the shoes of someone navigating this newly diagnosed reality, okay? Just imagine your body's automatic autopilot is suddenly turned off. Step 1, you have to manually intervene. Type 1s have to manually inject their keys. Type 2s have to actively scrub their locks via diet and movement. Step 2 requires this extreme daily mental math. I mean, you have to carefully balance your insulin, your food intake, and your exercise. Think about it. Too much fuel and not enough keys, high blood sugar. Too many keys and not enough fuel, dangerously low blood sugar. Which leads us straight to step 3, constantly monitoring the fuel by regularly checking blood sugar levels to avoid those dangerous spikes or drops. It's truly a demanding 24/7 job.
Section 4. The shared danger. High blood sugar damages everything.
Here's the thing. When blood sugar stays high over a long period of time, it basically acts like sandpaper inside your blood vessels. It damages both the tiny capillaries and the large arteries. And this is exactly where the confusion between the two types usually stems from, because the end results are identical. High blood sugar damages the really small vessels in your eyes, which can lead to retinopathy and potential blindness. It absolutely destroys the delicate filters in your kidneys, leading to potential failure. It damages your nervous system, causing neuropathy, which brings numbness and chronic pain. And it completely wreaks havoc on your cardiovascular system, greatly increasing the risk of heart disease and stroke. The biological mechanism of getting there is completely different, but man, the destination is unfortunately the exact same.
Which brings us to a quote from our source material that perfectly shatters a very common myth. The myth is that type 1 is the serious kind and type 2 is the mild kind. Quote, "Fact, both are serious. Untreated type 2 leads to amputations, blindness, and heart attacks. Well-managed type 1 can live a completely normal lifespan." Listen, there is no easy diabetes. Both of these conditions require diligent, serious, daily management to protect those blood vessels and avoid these severe complications.
Section 5. The big picture. The car engine and fuel analogy.
To really lock this all in, think of your body like a car. The blood sugar from the food you eat, that's the fuel. Your cells are the engine that desperately needs that power to run. And insulin is the specific key required to start that engine. If you have type 1, your immune system basically threw the keys into the river. You have absolutely no keys at all. You have to manually bring a new key to the car every single time you want to use the fuel. If you have type 2, you've got the keys right there in your hand, but the ignition cylinder is totally jammed with gunk. The key just won't turn. You have to clean out the ignition with diet, exercise, and pills, and sometimes down the road, you might just need a stronger set of keys to force it to start.
So, the next time someone mentions diabetes, you now possess the knowledge to understand exactly what's happening beneath the surface. You know it's not just one disease, it is a fundamental biological divide between a missing key and a broken lock. But for the millions of people living with either condition, managing that complex engine requires profound daily resilience. Knowing how delicate this balance of fuel and keys really is within our own bodies, it makes you wonder, how will you protect yours?